Welcome to this episode of Disease du Jour, where we will be discussing the Merck Animal Health Veterinarian Wellbeing Study 2, conducted in September and October of 2019 in collaboration with the American Veterinary Medical Association. I'm your host, Kim Brown, publisher of Equine Management. This study of U.S. veterinarians investigated well-being and mental health, critical issues facing the veterinary profession. The well-being study also examined job satisfaction, compensation, burnout, substance use disorder, cyberbullying, and suicide among veterinarians while evaluating potential solutions. Our guest for this episode of Disease du Jour is Dr. Christine Royal, the Director of Veterinary Professional Services for Merck Animal Health's companion and equine business. She earned both her Bachelor of Science in Microbiology and her Doctorate of Veterinary Medicine from Auburn University. Thank you, Dr. Royal, for joining us today on Disease du Jour to talk about the Merck Animal Health Veterinarian Wellbeing Study 2.
Thank you for having me, Kim, and especially to discuss this important topic.
Well, Dr. Royal, let's just jump right in and say first, why is Merck Animal Health investing so much in veterinarian well-being research and resources?
We're committed to the profession and supporting veterinarians through products and the solutions that we supply. And it's critically important for the long-term sustainability of our profession. We need to ensure that veterinarians are healthy and they have well-being. And second to that, when this issue first came to our attention and we had the opportunity to really take a look at the information that was out there, we found that there was no definitive assessment on what was the prevalence of mental health issues and well-being in the profession. There was a lot of talk about it, but not as many facts. And that really led us to having the passion to continue and do research in this area.
So with this second well-being study, have we made progress on veterinarian well-being?
We have made progress in veterinary well-being in just terms of awareness. So if we take a look at the data in terms of well-being, which is the measure of, you take a holistic view of your life, best possible life versus worst possible life. Where are you in that spectrum? If we look at the results from the first study versus the second study, it's unchanged. However, in that study, we also found that veterinary well-being is lower than the general population. And I think while we can, certainly paint a doom and gloom picture of, we're not getting any better, I think there's a couple of things that we need to take into perspective. Number one, that was only 2 years ago. We're, as a profession, this has really just been something that we've been talking about for the past couple of years. And we're continuing to figure out ways to support the profession. And I kind of liken it to as, if you if a horse comes to you and you're looking at working up that case, you need to do your physical exam, work up the case, run diagnostics, and that's essentially what we're doing with the study. Is we're running a diagnostics of the veterinary profession and then coming up with the tools and treatments to be able to help the profession. And we're still fairly new in that spectrum. So though it's unchanged, I think there is positive news around the fact that we're staying flat. It's not getting worse. We didn't know that before doing the study. We didn't know if it was continuing to get worse year over year. And then I also think it calls us to recognize that there's still much work to be done in this area.
One of the good things that came out of this study is that veterinarians really rated their job satisfaction very highly.
Absolutely. And I think that's why we're called the veterinary medicine, is because we love animals and the people that we care for. And I think that is really positive, that it's the intrinsic factors that relate to our job are positive, and we love what we're doing. it's a lot of the extrinsic factors that are causing us to perhaps not be willing to recommend it to others, the profession to others anyway.
So that's a good segue into, in this study, what did veterinarians say they were concerned about?
The highest concerns within our profession, I term it the 3 S's: high stress levels, high student debt, and suicide. Those are the hot topics that are keeping people up at night within our profession. Another one that I like to point out that I think we should kind of keep on our radar that jumped up 30% versus prior year is veterinarians seem to be more concerned than ever around the competition that is out there between veterinarians, which to me is concerning because I see it as colleagues, not necessarily competition. And so I think that there are some things that we can do around that. Additionally, new to the second study is we took a look at cyberbullying, and that's been another concern that we're hearing from the profession. And although it is important, it didn't pop into the top 3 to 5 concerns within the profession.
Yes, I know that it's a large concern over many of the veterinarians that I have talked to. In this study, you have used medical professional, human medical parameters to define well-being throughout. So how do veterinarians compare with human medical professionals as far as burnout and some of their problems?
Yes, so we used research conducted by the Mayo Clinic and looked at burnout and satisfaction with work-life integration. The main areas that we looked at were around hours worked, satisfaction with work-life balance, suicidal ideations, and then we compared that to physicians and employed adults. Interestingly enough, veterinarians do have a higher level of burnout, but that's not a function of increased work hours. We've heard a lot of times is, veterinarians are burnout or experience fatigue because they're working all the time. And actually we work less than physicians, but have higher rates of burnout. Some of the factors that are predictive of burnout are if you have a poor work-life balance, if you're not enjoying your work, if there's conflict when you go to work or between coworkers. Those are all things that can lead to burnout. And interestingly enough, food animal veterinarians are less likely to feel burned out than any other category of veterinarians.
And in this study, Dr. Royal, you looked at species type of practice as well as just overall veterinary practices. So what did you see in the differences? You mentioned one about the food animal there, but you did food animal, equine, and companion animal. Can you give us some insights?
Yes, it was interesting because in 2017, we weren't able to break out the different species or practice types. And so with the second study, we've been able to do that because the question here was, depending on what species or what type of practice you're in, does that impact your well-being and does it impact your mental health? And I can tell you in both well-being and mental health or psychological distress, food animal veterinarians actually have higher levels of well-being and lower psychological distress. When we take a look at companion animal and equine types of practices, there doesn't seem to be statistically significant differences.
So one of the things in the survey was that well-being seemed to be on average lower among younger veterinarians. What can you tell us about that?
Yes, well-being is lowest amongst younger veterinarians, and this trend continues from the first study. So that needs to be an area of focus is when we take a look at our younger veterinarians. what can we do to help get them to recognize well-being is important and should be a focus for them. We do see with our older veterinarians, so 55 age and older, they have a higher well-being, and it's actually higher than the general population. And so there's that point where we want to say for our younger veterinarians, hey, just hang on, as you age, it'll get better, your well-being will improve. But we can't say that. And that's the importance of the longitudinal study, is because there's so many additional, if you're a veterinarian that's age 60, when you were transitioning from vet school to practice, there were different factors there. So we can't necessarily make comparisons amongst the group. But I do think as we take a look at our younger veterinarians, we need to pay attention and stress the importance of well-being in their lives.
Today's Disease Du Jour podcast is brought to you by Merck Animal Health, the makers of prestige vaccines, Banamine, Panacur, Regimate, Protozil, and other trusted equine health solutions. Merck Animal Health works for you and for horses. Learn more about Merck Animal Health's comprehensive portfolio of products, as well as their ongoing investment in our industry, profession, and community at merckanimalhealthusa.com. And another area that this study showed that we need to continue the focus with these younger veterinarians is with serious psychological distress, that it's harder in younger veterinarians and more common than in older practitioners.
Yes, when it comes to serious psychological distress, and I do have to mention here that the majority of veterinarians are not distressed. However, we do have some veterinarians out there that are experiencing serious psychological distress, and our younger veterinarians are more susceptible. And as we compared it to our initial study, what we have found is that more veterinarians that are female are suffering from serious psychological distress, which to me is alarming, because as we look at our profession and the fact that we are moving towards more female veterinarians, this is something that we do need to pay critical attention to.
And again, when we're talking about these serious distresses, it saddens us every time we hear, and we would love to not ever hear again, that a veterinarian has committed suicide. But this study actually delved into looking at that problem in the veterinary practice. Can you give us some of the highlights on that?
Yes. So when we took a look at suicide ideation and planning, and keep in mind that this is a survey. This is not looking at a survey of those individuals who have unfortunately been successful in that. And there's some pretty alarming numbers here, because the way that we asked the question was within the past 12 months. So think about your past 12 months. We have numbers, and in our veterinary profession, if we look at AVMA numbers, there's about 114,000 veterinarians in the U.S. And almost 7,500 out of 100,000 have thought about killing themselves within the past year. Almost 1,500 out of 100,000 plan to kill themselves, and 174 out of 100,000 actually attempted to kill themselves. And I think these are really hard numbers to think about, that's happened, that we've had people in our profession that have had those thoughts or made attempts within the past 12 months. And so I think we have an opportunity to make sure that there's an awareness of resources for individuals that fall into these categories, so that we can move forward and hopefully have less of these within the future.
And I think that's a great segue into this. The studies that you all have helped fund have provided techniques and potential solutions to improve mental health and well-being. So what are some of the things that this study is pointing to help the veterinary profession be healthier in their well-being?
There's a couple of key takeaways here that I think, and I look at it in two different ways. What can I do as an individual, and what can we do as practices together? And for me, the number one thing that we can do both as an individual and as practice groups is to create awareness and also provide the resources and access to care if and as needed. We did find that veterinarians are becoming more caring towards those with mental health issues, which I think is critically important, because we know a lot of these individuals aren't getting the care that they need, or may not be aware of the resources that are out there, or may not be accessing resources or seeking care because they're worried about a negative stigma that might be associated with them. So I think the more awareness that we can as a profession, make sure that they know it's okay to say that you need help, or it's okay to take time off of work to get the resources and take care of yourself, I think the better off we'll be. I mean, as we take a look as individuals, we're such a caring profession that we take care of everyone else, animals, before we consider taking care of ourselves. And if we continue with that trend, we're going to have veterinarians who don't have anything left to give. And it's important to recognize the need to recharge your own batteries so that you can provide the appropriate care and compassion that's needed. As we take a look at, and I'll just kind of run through as an individual what you can do. Certainly, if your employer has an employee assistance program, if they have that, or if they provide health insurance, there are different resources out there that can help support you. But you have to ask, and you have to ask what the resources are and take the time to look into them. There are also telehealth solutions that can be accessed. They're fairly inexpensive and time efficient. So you've got ecounseling.com or 7cups.com. I would also highly suggest that individuals take the workplace well-being certificate program. So this was one of the programs that we've worked together with the AVMA and have funded. With the launch of the first study, they've developed 5 modules that are absolutely fantastic. I highly recommend it. It goes from talking about the importance of well-being in your culture, to giving and receiving feedback, to diversity inclusion, and things that you can use, real tools that you can use as an individual. I would say, if we're looking at it from what can a practice owner do, or what can we do together as a practice, again, it goes back to improving access and awareness. I would say that if you have regular staff meetings, perhaps invite someone local, a mental health professional that can come in and talk about well-being. Another key factor, as we point back to one of the big concerns in veterinary medicine, is finances and student debt. Invite a financial planner to come in from your local area and provide counseling. A lot of times they're willing to come in and do it for free. So those are some of the things that I would highly recommend. And we also will be having additional tools that will come up on our vetwellbeing.com website. And those will be providing phone numbers and also links to resources so that it's easy for you all to provide these resources to fellow veterinarians and even staff.
And Merck Animal Health has made a substantial contribution, and they're making another $100,000 commitment to follow up on this with the AVMA's Workplace Wellbeing Program and resources. This is what you were talking about earlier with the AVMA, their modules that you can take. What else would you say that is good as far as resources if an individual or a practice would like to be proactive on veterinary well-being?
I would say, encouraging your staff members to go to that website and take the modules and then potentially debrief in a staff meeting. You could do it together as everyone commits to reviewing a certain module for, over 2 weeks in time, getting together as a staff meeting and debriefing on it. Or if not everybody in the practice wants to partake, then certainly as an individual, you can do those. I would also, as I mentioned before, talking about getting engaged with a financial planner is going to be critically important. Also, having a stress management plan. I don't know that I really ever thought about having a stress management plan before getting involved with our well-being studies. And so having a written plan that when life gets a little too stressful, that you can go back and be able to really ground yourself is important. And we found that within the study too, is those that have a stress management plan are more likely to not be distressed or be a flourishing veterinarian. So providing opportunities to discuss that and compare, maybe pick something up from each other. And we've got a list of different stress management techniques that can be found at the vetwellbeing.com website as well.
That's great. And again, we want to tell our listeners that not only does AVMA have information about veterinary well-being, but the website is vetwellbeing.com that has some good information and resources available. Dr. Royal, is there anything else that you had wanted to add to this important topic about veterinary well-being and the study that was conducted?
I actually have two important points that I would like to stress that we didn't exactly get a chance to touch on, but no matter whether we look at veterinarians, physicians, the general population, one of the most consistent predictors of a happy life is the social relationships that you have. Checking in with each other, checking in with colleagues, making sure that you're connected to friends and family in a relationship are all things that add into your overall well-being. Second to that, and as a reminder for individuals, limit time on social media. There is a negative association between your mental health and well-being. And a friend and colleague, John Volk, told me, and I think this is something that resonates, is social media is not being social. So be cognizant of the time that you're spending on social media. Remember, for those of you with children or nieces and nephews, they're watching you too, and we need to leave a positive impact on them. So just wanted to leave everyone with that note as a profession, as colleagues, we truly value each other. And my call to action for all of you is, there's a colleague you haven't connected with in a while and you're listening to the podcast, give them a call after listening to this and check in with them.
What great tips to end this podcast, Dr. Royal, and we certainly appreciate you being with us today. And we'd like to thank you for joining us to listen to this episode of Disease Du Jour, and to thank our sponsor, Merck Animal Health. Please listen and rate previous and future episodes of Disease Du Jour on iTunes, SoundCloud, Stitcher, or your favorite podcast platform. Thank you, and be well.